You say it's a personal choice. In fact, to attend school in your state of Nebraska, children must be vaccinated against a number of diseases. Let me put them up on the screen. They must be vaccinated against diphtheria, tetanus and pertussis, polio, measles, mumps and rubella, hepatitis B, and chickenpox. Why are those mandates that parents in your state must comply with and do comply with routinely, why is it that they're not so objectionable and such a violation of personal freedom, but Biden's vaccine mandates are?
Well, for all those that you just listed, there's a long history that parents have had the opportunity to see how those things have been implemented. And there's still a lot of people out there who don't know what to trust. And in fact, this is really an outcome of what the CDC has done, because they've flip-flopped on so many issues, whether it's masks or whether you have to mask after you've been vaccinated and so forth. There's just a lot of people out there who don't know who to trust right now. And so by having the government force it on, you're not building the trust where we have the trust with those other vaccines. This is a process that's going to take time to bring people along, and that's why it should be a personal choice and not something mandated by the government.
But forgive me, sir, I'm old enough that I remember when the polio vaccine first came out. A lot of us, and certainly our parents, viewed it as a blessing, and immediately, I lived in New York State at that time, the state mandated that we all get the polio vaccine. So, you know, we're in the middle of a pandemic. There is a new vaccine that Donald Trump was largely responsible for. It's been approved, full approval by the FDA. Again, if the polio vaccine is okay for parents and they have to comply with it to send their kid to school, why not for a lot of people, not just kids, the vaccine for this disease?
Yeah, and I think this is very different from polio that has very devastating effects. And certainly we know if you're older, 65 years and older, that's where 83% of our deaths in Nebraska came from. We know this is really devastating. But we also know that nearly 87% of our 65 years and older population has been vaccinated. And if you're looking at young children, for example, here in Nebraska, we can look at the data and see that really children are no more at risk for the coronavirus than they are for the ordinary flu. And so it's all about balancing off these risks. And the risk for this is just such where this is something that we shouldn't be mandating it. Again, the whole goal for all we're doing, at least in Nebraska, how we're doing it, is around making sure we're preserving hospital capacity. And we've successfully done that here, even without doing statewide mask mandates and without doing vaccine passports. So let's keep the objective in mind, which is to be able to provide health care, and which we've successfully done here in Nebraska by protecting our hospital capacity, and not have the heavy hand of government come in and tell people what to do. They just don't want to hear it. And again, we can look at the data specifically around children and see the risk. Last year in Nebraska, if you were aged 10 to 19, you were 26 times more likely to die in a car accident than you were of COVID-19.
This is Fox News' Chris Wallace calling out the Republican governor of Nebraska, Pete Ricketts, who has promised to challenge Biden's recent vaccine mandate. All the while, in his own state, there are already vaccine mandates, and not just one or two, mandates for polio, measles, mumps, rubella, DTaP, Hep B, and chickenpox. And of course, Ricketts gives a slew of excuses that don't hold any water. He claims, for instance, that for those vaccines, parents had a lot of time to see how those things have been implemented. But a few issues here. First of all, the COVID vaccine has been out for nearly a year, and in terms of how it's been implemented, 99.9% of the people dying and getting hospitalized are the unvaccinated. That's how it's being implemented. Those who don't get vaccinated are 11 times more likely to die of COVID and 10 times more likely to be hospitalized from COVID, according to the CDC. That's how it's being implemented. How much more proof do you need? How much more time do you need? How many more deaths and hospitalizations do you need to see before you accept the objective reality that the vaccine is saving lives and that not being vaccinated for many people is amounting to a death sentence? Second of all, as Chris Wallace himself noted, we might be used to those other vaccines now, but when they came out, they were also new. And yet a vaccine like polio was mandated anyway, even though it was new, and guess what we don't have to worry about anymore? Polio. In fact, Republicans likely owe the fact that Mitch McConnell is alive today to the polio vaccine. Imagine, though, that the polio vaccine wasn't mandated and that half of the country opposed it and allowed it to mutate and effectively ensured that polio would become just a regular element of society that we'd have to deal with. Sounds horrible, right? That is exactly what Republicans and people like this governor are doing right now by virtue of opposing this mandate and prolonging this pandemic. Ricketts goes on to blame the vaccine hesitancy not on what he himself is doing in this very interview, but rather on the CDC. Of all things, the CDC. Right. It couldn't possibly be, oh, I don't know, the Republican Party, which has aggressively fomented anti-vax sentiment for months now. It couldn't possibly be Fox News, which has led an all-out assault on the vaccine. It couldn't possibly be Donald Trump, announcing that he probably won't be getting a booster. It couldn't be that of every political group, Republicans are the least vaccinated in the country, which is clearly the result of the people who Republicans listen to. Nope, apparently it's the CDC's fault. Right. Ricketts then says that in order to build trust, the process is going to take time. Here's what he doesn't seem to understand. We don't have time. Every day that we're not reaching herd immunity is another day that this virus can mutate. And then those vaccines that people are spending so much time getting to trust won't be effective anyway. What we need to be able to trust are the medical professionals and scientists. Not the politicians with their degrees in poli-sci, but the actual experts who say this vaccine is safe, as well as the billions of people across the globe who have taken this vaccine with overwhelming, staggering success. You can't claim that you want to build trust while simultaneously undermining the results that we're supposed to be building trust in. But here's the single most absurd point that Ricketts tries to make, that the top priority is protecting hospital capacity. Not keeping as many people alive as possible, but just making sure that the hospitals don't fail, and then as long as you can do that, then you've succeeded. And so even though Ricketts has the ability here to take strong action and to save the lives of Nebraskans who would otherwise die without some intervention, that's not what he's concerned with, because his only priority is apparently hospitals. But sure, pro-life or whatever. And just one last point here to just drive home how tenuous this argument is. Ricketts says that if you're a child in Nebraska, you're 26 times more likely to die in a car accident than by COVID. But A, car accidents are not contagious, so comparing a car accident with a communicable virus is ridiculous. And B, a virus being less deadly than something else doesn't make it okay. You could be 100 times more likely to die of a car accident than of COVID. That doesn't mean we shouldn't still take steps to ensure that kids don't die of COVID. The same way we took steps to ensure that kids don't die in cars by installing traffic lights and mandating seatbelts and requiring drivers to have licenses and making car seats compulsory and on and on. And the fact that these Republicans would rather defer to tired whataboutisms than simply use that energy to ensure that their own constituents survive is all the proof you need that as far as they're concerned, their politics are more important than your lives. If you enjoyed that video and you're looking for a deeper dive, check out my podcast, No Lie with Brian Tyler Cohen. It's a no BS look at the top stories of the week, along with interviews with the top names in politics, like Vice President Kamala Harris, Jen Psaki, Elizabeth Warren, Nancy Pelosi, Chuck Schumer, Katie Porter, Pete Buttigieg, and more. Again, that's No Lie with Brian Tyler Cohen, available anywhere you listen to podcasts. Also, if you want to see more videos like this one, click the subscribe link right here on this screen to join the more than 1 million people who've already subscribed to my channel. And finally, to donate to my Don't Be a Mitch Fund, where I'm raising money for a whole raft of different voter outreach and voter registration groups in the closest states ahead of midterms in 2022, including Georgia, Pennsylvania, Wisconsin, North Carolina, and Texas. You can find that link on this screen as well. Thanks for watching.